Wonderful. So I can good morning or good afternoon to everyone, depending where you are. My name is Monik Mossini. I'm a psychotherapist, and I am affiliated with the Carlos Albizu University here in Miami. My most recent research is on mental health, more specifically, like of teenagers. And recently, given the rates of mental health illnesses have spiked, especially after the pandemic, I have started researching different interventions, including the use of dialectical behavioral therapy. So that's what I'm going to be talking about today. Let me just see here. We got it. Okay. So as we all know, adolescence is a pivotal developmental phase characterized by significant transition and numerous challenges. And it is during adolescence that individuals navigate a complex interplay of peer influence, societal expectations, and the quest for autonomy, contributing to emotional stability. So research indicates that adolescents are particularly susceptible to mood disorders due to incomplete development of brain regions that regulate emotions, right? Like a frontal lobe, that part of the brain is not fully developed until you are 25 years old. And dialectical behavioral therapy, also known as DBT, offers a promising intervention for addressing emotion dysregulation and maladaptive behaviors among the adolescents, equipping them with the essential skills for emotional management and resilience. So adolescents face escalating levels of emotional dysregulation, coinciding with concerning surge in mood disorders such as major depressive disorder and disruptive mood dysregulation disorder. And the onset of COVID-19 pandemic has exacerbated those challenges, leading to a notable increase in youth psychiatric inpatient hospitalizations. So right now we see rates of depression, anxiety, DMDD at rates that have not seen before. Depression rates have been seeing a worrisome rise, with a staggering increase from 8.1% in 2009 to 15.8% in 2019, right before the pandemic, indicating like a troubling trajectory. So this was even before the pandemic. And after the pandemic, like the number, the rise in hospitalizations, Baker Act, that number has just spiked. Emotional distress is particularly pronounced among female students, with 60% reporting feelings of sadness or hopelessness in 2021, and an alarming 25% reporting like a suicidal ideation. And this gets even worse for the LGBTQ population. Those students are even more affected by mental health illnesses, with an alarming 25% reporting suicidal ideation or experiencing like symptoms of depression. Adolescents are more likely to engage in self-harm. I don't know how to take your picture. Okay, there. Adolescents are more likely, they are likely engaging in self-harm at rates significantly higher than officially reported, highlighting the complexity of addressing mental health challenge among this population. And part of it is that in this population, when they self-harm, it's usually like a superficial, like it's not severe enough for them to be taken to the hospitals. So what that does is that we don't really know how serious and severe this is. And research shows that there is a connection, there is a correlation between self-harm and suicidality. And suicide stands as the second leading cause of death in adolescents worldwide, underscoring the urgent need for comprehensive intervention and support strategies to address the mental health, given that's so vulnerable. So I'm not sure if you're all familiar with dialectical behavioral therapy, but this modality was created by Marshall and Linehan in 1993 as an outpatient treatment program specifically designed for individuals diagnosed with borderline personality disorder and chronic suicidal behaviors. So DBT initially consisted of a comprehensive treatment model comprising individual sessions, group skills training, phone coaching, and therapist consultation teams. And the group skills training component of DBT focuses on teaching 4 sets of behavior skills. There are mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance, delivered through instructional sessions, group discussion, and exploration exercises. So in a session or in a group session, here I added, so I'm gonna just give you some examples so you know what teenagers will learn like in that session. You know, there are many different skills, and DBT is a very active type of therapy. It's not just like a talk therapy. So what happens is that our clients have access to practical skills that they can implement within like the first day that they have like this session. But what happens is what was created in 1993 to address the needs of a very specific population is that DBT has evolved, and recent studies have shown promising pathways through DBT skills for assisting adolescents in regulating their emotions. DBT equips adolescents with practical tools to recognize, understand, and regulate their emotions effectively through techniques such as mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness, leading to significant improvements in emotional regulation and overall well-being. So for an example, like in sessions when we speak about mindfulness, mindfulness is not like just meditation, you know, that's one way to practice mindfulness, but there are many different exercises that can be used. One that we use a lot with adolescents is mindful breathing, where one learns how to focus attention on the breath, observing thoughts without judgment, and practicing present moment awareness. In interpersonal effectiveness, we talk about many different things, but one that's big is the Dear Man skill. It comes down to communication. And when you're talking about adolescents, this is particularly important given that they tend to have a lot of challenges in their relationships with their peers, with their parents, and so forth. So in the Dear Man, we teach them assertiveness, which is a skill involving describing, expressing, asserting, and reinforcing one's needs while maintaining self-respect and the relationships. In emotion regulation, we talk about opposite action. That's just one of the many skills we talk about. But when we talk about opposite action, we're suggesting that one should act opposite to an emotion to reduce its intensity, such as engaging in activities that counteract feelings of sadness or anger, if that is what the person is experiencing in the moment. In distress tolerance, we talk about radical acceptance, which means fully acknowledging and embracing reality as it is, without judgment or resistance, to reduce emotional suffering and increase psychological flexibility. So these are just like 4 examples, one example for each one of the things that we talk about in DBT when it comes to skills training. So I worked on a systematic literature review, including keywords such as DBT skills, emotional dysregulation, dialectical behavioral therapy, and emotion regulation, and studies conducted between 2000 to 2024 involving adolescents aged 12 to 18 experiencing mood dysregulation, mood disorders, suicidal ideation, self-harm, and oppositional defiant behavior, and conducted in the United States, Canada, or Europe, or including for analysis, resulting in a diverse sample of 908 participants across the retained studies. So DBT skills have been identified as a promising intervention for addressing emotional dysregulation in adolescents. Now, this comprehensive analysis of research involving those 908 adolescents showcased significant improvements in mood and mood disorder-related symptoms following the completion of DBT skills programs, underscoring the potential of DBT in meeting the complex emotional needs of adolescents and promoting their mental well-being. So, integrating DBT principles into existing mental health frameworks and educational curricula could enhance accessibility and dissemination of support for adolescents' emotional regulation and mental well-being, offering valuable avenues for comprehensive intervention strategies. So again, when we talk about, imagine how wonderful it would be if we could include, many schools for young children, they teach like the kids social skills. The same way, the idea is it could be beneficial if we could do something similar for teenagers as a preventive like a manner, not only like when we have problems and we're seeing these adolescents being hospitalized for being danger to themselves or others. So while the effectiveness of DBT intervention is evident, future research should address limitations such as the study setting, specificity, and variability in the methodologies to better understand the long-term efficacy. So some of the limitations I had is that, there's still like not that many studies when it comes to the effectiveness of skills for this particular population. And what happens is there are so many different like skills that are offered in DBT that it's hard to assess if they're like a certain set of skills they're more effective than others. And also across the studies that I used for this literature review, some of them were conducted in an outpatient setting, others was inpatient. And there is another study that was conducted in a school setting, which was a really nice study done in Spain. They all show that DBT is effective, but again, we can gauge specific settings or specific skills when it comes to gauging their effectiveness. So the systematic literature review underscores the pressing need for effective interventions to address escalating rates of emotional dysregulation and mood disorders among adolescents, emphasizing the significant impact of those challenges in their well-being. DBT interventions offer promising avenues for tackling emotional dysregulation in adolescents, equipping them with essential coping strategies and skills to navigate challenging emotions and situations effectively, thereby fostering resilience and well-being. And one of the reasons why, like in my experience with teenagers, is just it's something so practical. It's easier for teenagers to grasp. When we see them in the office for DBT sessions, it's not something so abstract. It's not just like, oh, sit, close your eyes and think of what's causing like your distress. We're giving them practical skills that the moment that they leave the office, they could like start implementing and they'll see those results. And once they see, those results, that's enough motivation for them to keep practicing them. And of course, like any other skill, it comes down to practice, practice, and practice. The more they practice, the better they get at those skills, and the more naturally they'll respond to stressors using the skills that they have been using. So some of the recommendations here would be to prioritize the integration of DBT skills training into existing interventions for adolescents. It's crucial for enhancing emotional regulation and preventing the escalation of mood disorders. Collaboration among mental health providers, educators, and caregivers is essential to provide comprehensive support for adolescents, including implementing DBT skills trainings in school curricula and offering resources for parents and guardians to reinforce those skills at home. So what we've done here is that we also created like a skills training for parents, and we see that when parents are involved and they learn the skills, their children have like a better results like in therapy. But there's like when parents are not involved, what happens is the kids come, they spend weeks and weeks of training, some of them like in a PHP setting, receiving 20 hours of therapy weekly. When they get home, they suffer from invalidation, or parents who are not, it comes from a good place, but they're not like prepared to deal with certain or guiding their children like how to use these skills. So that staggers like a progress, and kids ended up like staying treatment much longer. So this is just like the poster that I created for this presentation. If you use the QR code, you're able to download it. And in the QR code of the poster, you'll find all my references. The list was pretty extensive, so I came up with a bunch of QR codes. So here you have my references again. And again, I'll take any questions at the end. And if you want to follow me and learn more about my research and what we're doing here, in South Florida, feel free to follow my page. So that concludes my presentation, and I'll take questions at the end once everybody else is done.